and share my screen. All right, now I'm going to go dark while we do this because I want you all to focus on our presentation. Okay, there we go. So like I said, let me do this too. I have one more thing to do. There we go. All right. So today's presentation is on SKNditioning, your ultimate skin assurance. So when we are working to precondition the skin or SKNdition the skin, right, as we like to call it, it's an ever-evolving world of skincare. Results-driven professionals understand that no advanced treatment can succeed without proper preparation. So enters SKNditioning, the foundational process that ensures both your client's skin and your practice are set up for success. You'll want to think of SKNditioning as your skin insurance, a protective, proactive measure that safeguards the skin and optimizes the effectiveness of every treatment you offer. SKNditioning is a comprehensive approach to preparing the skin for advanced protocols. By repairing, strengthening, and balancing the skin barrier, it involves using targeted, scientifically formulated products and techniques to create a healthy, resilient foundation for transformative results. Dermodality's line of level 1 peels and conditioning serums are specifically designed to facilitate this process, making them an essential part of any esthetician's toolkit. Now, at Dermodality, we treat all clients as if they have a compromised barrier. And the reason for this is because visual integrity doesn't always equal functional integrity, meaning that when your clients come in to see you, maybe it's the first time or maybe it's the first time in a long time, their skin on the outside might look great. However, due to lifestyle choices and other things that can wreak havoc on our skin, like stress and poor diet, the outer skin might look great, but the skin doesn't function great on the inside. And so that's why it's important to always treat our clients as if they have a compromised barrier, because just because we can't see redness or irritation at the surface doesn't mean that the skin isn't compromised down below. So why is SKNditioning an essential part of your business? Well, number one, it does reduce the risks and complications. So a properly conditioned skin minimizes the likelihood of post-inflammatory hyperpigmentation, or PIH. It can also limit irritation or prolonged downtime, especially for clients with a darker Fitzpatrick skin type. So then two, it strengthens the skin's barrier. A compromised barrier can lead to sensitivity, redness, and even adverse reactions during the treatments. So conditioning repairs and fortifies the barrier, ensuring that the skin is ready to tolerate more intensive procedures. Then you will receive enhanced treatment outcomes. A healthy, balanced skin absorbs high-performance ingredients more effectively, allowing treatments like chemical peels, microneedling, or even laser therapies to deliver optimal results. And then finally, it'll increase client satisfaction. When clients see better results with less discomfort, they're more likely to trust you and return for future appointments. And best of all, they'll recommend you to their friends. The best way to build your business is through recommendations. So let's take a look at what contributing factors compromise the barrier. So overexfoliating the skin tops the list, right? We know, or our clients know, that as we or as they get a little bit older, their skin starts to get rough and tough, and it's dull looking. There's not that glow that they had when they were, in their early 20s. And so they think that the best thing for them to do is to exfoliate. And sometimes that exfoliate can be over exfoliation with the wrong product, too aggressive of a product, or too often that they're exfoliating. And every time they exfoliate their skin, it could lead to surface irritation, which can lead to inflammation, which can lead to hyperpigmentation and a destruction of those dermal proteins. The next one is incorrect product use. This is a big one because a lot of times people don't have an esthetician, or they feel embarrassed to go to their esthetician and ask them what's wrong and what they recommend. So they'll just stroll up to the beauty counter or maybe a drugstore or even online, and they start looking for products that they can sort of self-diagnose them for. So they purchase all these products, and at the end of the day, nothing seems to work. None of those products work to change the structure and function of the skin. They don't help the skin to look any better. And so what occurs is that they have a whole drawer full, or maybe a cabinet full, of products that they just don't use. So that's where we, as estheticians, the skin experts, come into play, because we can take those products and maybe sort out a few that are beneficial, but we can really take your client on a journey of using the correct home care products and even building them as they go. So as the skin becomes more healthy and more resilient, we can add in different products. Then there's the harsh ingredients. Now, this one for me is a little controversial because although there are ingredients that can do damage to the skin and cause irritation and inflammation, I really believe that good professional skincare lines like Dermadality Skin Solutions don't put harsh ingredients deliberately into their products. When I think about harsh ingredients, I'm thinking about someone who's using, again, the incorrect products. So a product line that might be great and effective for somebody with oily, acneic skin might be too harsh for somebody who is dry or dehydrated. So again, we want to take a look at what your client is using. You can ask them to come in with all of the products that they're currently using. Take a look at the back of the ingredient deck and see which ones have some of those stronger ingredients that might not be appropriate for your client's skin type and concern. Of course, there's too much sun exposure, so this goes hand in hand with lifestyle choices. So if you are someone, or if your clients are someone who loves to spend a lot of time out in the sun, especially without sunscreen, to get that nice, beautiful tan, right? You're causing severe damage, not only to the surface of the skin, but even in the deeper layers of the skin. And then lifestyle choices can compromise the skin as well. So things like cigarette smoke or drinking, stress can cause inflammation in the body, poor diet, lack of sleep. There are so many things that can affect how our skin responds. So we want to also, when we're doing a consultation and then a skin analysis with our clients, we want to make sure that we talk about the things that they're doing outside of your spa. And lastly, medication, whether it's prescription or recreational. A lot of medications can cause photosensitivity on the surface of the skin. So what that means is that while they're taking that particular medication, it is even more important that they avoid direct sunlight and especially wear sunscreen. So I have a question for all of you. And what I want you to do is go ahead and write that question into the chat, write your answer in there, because we will choose everyone who answers the question correctly will be put into a drawing to receive a very special gift in the mail a little bit later. So you'll also want to include your mailing address in that answer as well. So here's the question. What is the number one anti-aging product on the market today? Again, what is the number one anti-aging product on the market today? All right, so you guys go ahead and put those answers in the chat box, and I'm just going to continue. There we go. All right. So, what's the main purpose of conditioning the skin? Well, ultimately, it's to minimize inflammation. And that inflammation could weaken the skin's barrier during or following any skin irritation. So, whether it's self-induced irritation or whether it's irritation from a corrective facial, right? This could lead to inflammation. And acute inflammation is really important to the repair of our skin. When our skin becomes inflamed, it sends many chemical messages to start the healing process. But in many cases, inflammation can be chronic. And with that chronic inflammation, it causes increased sensitivity and irritation at the surface. It breaks down the barrier and or makes it even worse. This could lead to prolonged healing times, risk of infection, loss of hydration, and ultimately post-inflammatory hyperpigmentation. And then when you're trying to strengthen the skin and you have that chronic inflammation at play, it could also have adverse reactions to those treatments and poor treatment results. So remember, the goal is keep inflammation to a minimum. Inflammation in general is the devil for not only skincare, but for all internal and external issues. Inflammation is caused by many things, including stress. However, inflammation, like I mentioned before, is what we need in the treatment room to cause the controlled injury. So that controlled wound response is what we want, but it's caused by inflammation. So we have to be super cautious, especially in the beginning, while the skin adjusts to the inflammation. And kind of a sort of analogy that I always think about in this case is, think about if one day you wake up and you decide you want to run a 26-mile marathon. So the first thing you do, because you don't have, sneakers or time to buy sneakers, so you go in the back of your closet and you find these sneakers that you've had for about 20 years. And so then you go out and you just start running that 26-mile race. So at the end of the day, you may have crossed the finish line if you did not collapse somewhere along the route. And if you did finish at the finish line, how are you going to feel? You're going to be out of breath. Your muscles are going to be sore. You're going to be extremely tired, right? So the best thing to do is to invest in a good pair of running shoes and then gradually work yourself up. So starting with a half a mile and then a mile, then 5, 10, 20, but ultimately 26 miles. By the time you finish that finish line, cross over the finish line, you'll feel tired and all of that, but you won't be in as much pain or discomfort as if you had not gradually worked yourself up. So conditioning is the same thing. We want to gradually strengthen our client's barrier function to prepare the skin for stronger treatments. So let's talk a little bit about what's happening when we perform these controlled injuries on the skin, whether it's a peel of some kind, like an advanced peel or a strong peel, whether it's microdermabrasion, microneedling, all of that stuff. Once you are performing those treatments on the skin naturally starts to become inflamed. And this inflammation is really the first phase in the healing process. So when the skin gets injured, the body sends immune cells to the area. So it becomes inflamed, and then the body sends immune cells to the area. The skin can get red and become inflamed and even warm. And this is when your white blood cells rush in to kill that bacteria, remove the dead, damaged cells, and clean out debris. The body at this time starts forming the foundation for new tissue and blood vessels to be created. So the second phase is proliferation. And proliferation is when the new cells and the new blood vessels are being made. It's also at this time that the fibroblasts way down in the dermis start to make collagen. The collagen that they're making, however, is something called collagen 3. And collagen 3 is a temporary collagen. It's kind of like if you're wanting to build a house, you would start with the foundation and you might start with a wood scaffolding. So that's collagen 3. At the same time, these fibroblasts are secreting growth factors and cytokines, which send various messages throughout the skin to create new cells, right? Or to you know get rid of the old dysfunctioning cells. Um, and these new blood vessels form to bring oxygen and nutrients while the new skin cells move to cover the wound and start to heal it. And then in phase 3, this is the remodeling phase. So this is where that early collagen, collagen 3, the weaker and temporary collagen, gets replaced with that stronger collagen, collagen 1. And collagen 1 is what our body or our fibroblasts primarily make when our skin is healthy and strong. So, but when it's injured, fibroblasts just want to spit out anything to give the skin some support, and that happens with the collagen 3. So the collagen 3 gets replaced by the stronger collagen 1. This then tightens and firms the skin, and the skin structure becomes more stable and resilient. So this is why it's so important that when you are looking to change the structure and function of the skin, you will want to cause a slight controlled injury. It doesn't have to be drastic, and the injury doesn't have to go all the way into the dermis. It doesn't. We as estheticians legally cannot work in that area. We really can only work at the stratum corneum layer, the layer of dead skin cells. But with proper device application and products, we can signal our cells to do a multitude of different things throughout the rest of the epidermis and all the way down into the dermis. So SKNditioning, the dermodality way. Dermodalities products are uniquely formulated to support the SKNditioning process, ensuring safety and efficacy for all skin types. It also prepares the skin prior to any deeper treatment, kind of like our level 2 chemical peels or other ablative modalities like microneedling or radiofrequency microneedling, and even up to lasers. When you condition the skin, it provides a predictable and successful outcome. It also reduces the risk of hyperpigmentation. It can refine the texture and improve fine lines and wrinkles. It ensures better treatment results and allows treatments for all skin tones. So what's great about this process of SKNditioning is that you can treat any Fitzpatrick scale. You can treat any age. You can treat any ethnicity, any skin condition, right? And any skin type. So during this process, we determine let me say that again. During the SKNditioning process, we determine how your client's skin is going to react to various things. And then we work to strengthen the skin so that we can do some of these more advanced treatments. It provides for the ability to reach deeper layers of the skin safely and effectively, and it affects production of collagen and elastin for long-term effects. So again, SKNditioning is an absolute must before moving on to any dermodality-based, I should say level 2 treatments, those are our peels, or any advanced treatments. So how do we do that? Well, we start with the foundation, our level 1 peels. They are gentle yet effective. customizable and versatile, suitable for all Fitzpatricks. And here at Dermodality, we call our Mandelic plus hybrid peel our indicator peel. Now, let me explain a little bit about what that means. Because of the structure of this peel and its molecular size, along with the fact that mandelic acid is an alpha hydroxy acid and works exactly like all the other alpha hydroxy acids, with one key difference: it is oil soluble. So our skin actually responds more positively to that, because at the surface, in our acid mantle or barrier, it's loaded with things like lipids and ceramides and natural moisture factors. And so the large molecular structure and the fact that mandelic acid is oil soluble makes the solution a more gentle yet effective choice when treating your clients for the very first time. So our protocol really encompasses starting with this solution first. So if you have a client that walks in, it's the first time you're seeing them, and you're not 100% sure how you think their skin's going to react, go ahead and apply the mandelic acid onto their skin, and then wait a couple minutes and check in with them. If they're having a severe adverse reaction, meaning like their skin is on fire, it's really intense, you're noticing visually a lot of erythema or edema in the skin, you'll then realize that their skin is very compromised, and you'll want to neutralize and take this solution off immediately. But what that will tell you is that the skin is extremely compromised, both at the surface and possibly underneath, and you'll have to take this client on a slower journey to acclimate them up to stronger treatments. Now, if this client comes in first time and you put the mandelic acid on and they have no visible reaction, and they're not feeling much, maybe just a very low, maybe spiciness, then you know that the skin is a little bit more healthier, and you can start to acclimate them up to layering treatments and even stronger level one peels, such as our intensive brightening, sooner. So when I'm teaching, I'm really all about the who, what, when, where, why, and how of products, especially the why. I always want to know why something works, right? And so this is just like a little graphic that you can, take down and just kind of understand that with our Mandelic plus hybrid peel, when performing this on your client, we want to use it at the beginning of a corrective journey during the SKNditioning phase, or when transitioning clients into a more advanced treatment regimen. We always want to perform this in the professional treatment room, right? This is part of your process at your spa to gradually work your clients up to corrective protocols. We're going to then use our level 1 AHA peel, Mandelic and hybrid peel, which is a superficial, low intensity chemical exfoliant designed for safe, controlled skin renewal. And the reason why we want to do this is because it's extremely gentle. It'll help to refine the texture, brighten the overall skin tone, and support clearer skin. This helps to improve the skin's readiness while minimizing irritation and having a low risk for post-inflammatory hyperpigmentation with no downtime. So how it works is by loosening the corneocytes at the top level of the stratum corneum. And it helps to encourage controlled exfoliation and cellular turnover without unnecessary inflammation. Best results are achieved when paired with proper home care regimen. And that is something that's extremely important that we'll come back around and talk in just a little bit. Now, I want to talk about injury-based treatments that force change versus conditioning-based treatments that prepare the skin for change. Now, this is not about one approach being right and the other being wrong. It's more about using the right tools at the right time. So, injury-based treatments like microneedling, radiofrequency peels, and lasers work by creating controlled injuries to trigger repair. They're powerful, and when the skin is healthy and resilient, they can absolutely drive change. But they rely on inflammation and the wound healing response to get those results, which means more downtime and more risk for reactive or compromised skin. So, when we're doing the conditioning based modalities, they work very differently on the skin. So, instead of forcing change through injury, we prepare the skin for change. We focus on optimizing the barrier, supporting the cellular communication, and improving the skin's readiness to respond. We can also add in different modalities or devices, such as dermaplaning, which can help refine the surface, Juvasonic, which can activate the skin, and dermasomes that support recovery and resilience. So, what are you going to take away from this? Well, injury based treatments are great when the skin is ready for them, but conditioning is how we get the skin ready in the first place. This is how we create safer treatments, better tolerance, and more consistent long-term results. All right. So let's talk about how we take our clients on this journey. So at Dermodality, we have created 3 stages or levels of facial protocols that will gradually work your clients up to stronger and stronger treatments, ultimately having them come to the point where they can now do a lot of those injury-based treatments like microneedling and laser. So, what are the benefits of stage 1 treatment? So, this one is a full facial where you will double cleanse, prep the skin, apply the Mandelic solution on the skin. You'll leave it on for a determined amount of time, depending on the client's tolerance. You'll then neutralize it and remove it, apply the gel mask, remove that, and then add in the hyaluronic pro to really help the skin hydrate and to calm down any redness or possible inflammation. Not that the Mandelic causes a lot of inflammation on the skin, but if your client's skin is compromised, it could. And then we're going to follow up with the appropriate moisturizers, sunscreen, and eye cream. So what this does is it introduces gentle exfoliation with alpha hydroxy acids. It hydrates and protects the skin, improves the overall skin health, and ultimately enhances treatment receptivity. Once we have determined that they are able to go up to the next level, we introduce stage 2. So this starts off just like stage 1 does, but in this case, we now incorporate our pumpkin multifruit enzyme exfoliator peel on top. So now we're going to layer these 2 exfoliants on top of each other. So you're not going to remove the Mandelic. You're going to wait until that dries, and then you're going to apply the pumpkin peel right on top of that. Once again, you're going to determine the length of time. We say no more than 7 minutes for each layer. So 7 minutes for Mandelic, up to 7 minutes for the pumpkin peel. And then what you'll do is you'll neutralize it and remove that. You'll then follow up with our Dermodality oatmeal mask for calming and soothing. And then you'll add in some serums, some reparative serums, the right moisturizer, followed by eye cream and sunscreen. So what stage 2 does is it amplifies the Mandelic peel and its effectiveness. It delivers a brighter skin and provides even more hydration. So as we go through these stages, we're creating a stronger and stronger skin barrier. Finally, stage 3. So again, it starts off exactly like the others do. Once you get to the layering of the mandelic solution layered with the pumpkin, we're going to leave that on for a designated period of time and then neutralize it and remove it. We then are going to add in our seaweed mask. So seaweed mask is great because the skin has already started to transform. And what the seaweed mask is, it really helps to reduce some of those fine lines and wrinkles and improve the overall texture. We remove our seaweed mask, and our final layer is our Intense Cascade 2020, which is an 8% retinol that is applied directly onto the skin and then left there. Your clients are going to go home with this, and you're not going to put anything else on top of it. So you're not going to put other serums or moisturizers or even sunscreens on this. So when you are performing this facial, you will have to have a conversation with your client to let them know that retinol is a very sun sensitive ingredient. And so they'll want to take extra precaution because you do not want to apply sunscreen over this retinol booster. Now, when we are performing any and all of these treatments, and then even if you're doing things like microneedling or our level 2 peels, which are Jesners and TCAs, you're going to want to constantly check in with your clients. And I know that most of us do this, and we usually do it on a scale of 1 to 10. But after the many years that I've been in the business, I've come to find that 1 to 10 is a little confusing, with most people saying 5. And that leaves me more puzzled than before because I don't know, should I remove the peel or stop the treatment, or should I continue? So I've sort of developed this 1 to 5 rule, which is where you ask your clients, and you can ask them several times during the procedure, on a scale of 1 to 5, how is your skin feeling, right? And so now what I'm going to do is I'm going to give you what that scale means. So if they answer 1, that means that they're not feeling anything at all. And especially with our indicator peel, the mandelic peel, this is a good thing because it means that the skin is fairly healthy, right? 2, slight tingling, maybe some spiciness, but completely not uncomfortable. So you can go ahead and leave that solution on for the full amount of time. Now you see that I have the 3 crossed out. I'll come back to that in just a second. 4 tells us that they are uncomfortable, but they're going to power through it. But this is where you, as the esthetician, needs to pay close attention for any visible adverse reactions, meaning you're going to take a look at the skin for any redness or any inflammation, blotchy redness, welts, anything that could cause an adverse reaction. The other thing you want to look for is during this time is how is your client reacting? For instance, are they moving their face around like if they're trying to scratch it without using their hands? Are they fidgeting in the bed? Are they squeezing their hands really tight? All of these things indicate that, yeah, it's more uncomfortable than they're letting you know because they want to get the full application or the full time on this peel, not understanding that even though we leave those products on the skin for a lesser amount of time, it's still going to help to strengthen the skin's barrier. And then lastly, extreme discomfort. And this is where you're going to remove the products as soon as possible. And you're going to deliver a cooling like towel or cooling SD wipes or cooling sponges just to really calm down any discomfort that your client might be experiencing. So remember I said I was going to go back to 3? So 3 to me is an on the fence answer. And so what does that mean? It means that if they answer 3, well, what do you do at that point? Do you lean more towards 1 or 2, leaving the products on for the full amount of time? Or are you leaning more towards 4 or 5, meaning that you have to pay closer attention, watch their body movements, their facial expressions, or remove it as soon as possible? So this is just a little check-in that I came up with just to make your life and our customers' life easier when telling them where their skin is reacting. Now, one of the other things that we have discovered with our skin conditioning program is the fact that we can add enhancements that really add value to our skin conditioning treatments. So up to this point, everything we've talked about in the skin conditioning program works beautifully on its own. These protocols are already proven to improve skin health, the barrier function, and treatment tolerance. But what this slide represents is how we can grade those same protocols to get even better outcomes without changing the foundation of what we're doing. So when we add things like dermaplaning, we're helping to refine the canvas. When we're removing the excess corneocyte buildup and the surface debris, the skin becomes smoother, more even, and even more receptive. This doesn't take place of the skin conditioning program, but it makes it work more efficiently. Then, if we add in our Juvasonic, we're actually activating the skin. The sonic energy helps to stimulate circulation and cellular responsiveness, which means that the skin is more awake, more responsive, and better able to utilize the products that we apply. And again, we're not forcing change, we're supporting the skin's natural biology to respond better. And then finally, when we layer in our dermasomes, we're supporting recovery. This is about calming inflammation and engaging repair and helping the skin bounce back for faster and stronger results, especially when we're working with more advanced treatments. This step can make a noticeable difference in how the skin tolerates and recovers from these services. So here's the big idea. We're not changing our conditioning philosophy. We're just enhancing it with dermaplaning, which refines the surface, Juvasonic, which activates the skin, and dermasomes that support recovery. Together, these upgrades elevate our already proven protocols and help us deliver safer, more consistent, and more impressive results for our clients. So many times when I'm doing this presentation, early on, people ask this question: how often can we or should we do these treatments? So as an esthetician, you're probably aware that every 4 weeks or so, every 30 days, we basically have a whole new set of skin cells at the surface because our body does work. Even as we get older, our body does work like a well-oiled machine. So doing treatments every 4 to 6 weeks basically takes you back to the start, takes you back to ground zero. So in order to make noticeable changements in the skin, we recommend that you do these treatment intervals every 2 weeks. And because our clients can go anywhere, do anything, start something, we do recommend a minimum of 2 treatments for each stage, with the option for continued sessions as needed to achieve optimal results. So what does that mean? Well, it basically means that your client comes in, she's a first-time customer. You're going to start her on this conditioning program. You do the first treatment, everything goes well. She had no reaction to the mandelic solution. You send her home with a next appointment scheduled in 2 weeks. 2 weeks comes by, you do the same treatment, and now her skin reacts badly. It gets really red, it's uncomfortable, her skin is hot, and she's screaming for you to take off the same product that you had just put on her skin 2 weeks prior with no problems. Well, what you guys didn't talk about, right, is the fact that she was on vacation for a week and sat out in the sun and had a lot of, pina coladas. And her skin, although looking healthy at the surface, was unhealthy and compromised underneath. And so that same treatment, that same product that you used 2 weeks earlier is now causing an adverse reaction on the skin. So this is what we talk about when we talk about you should do at least 2 treatments of the same treatment or the same stage, so that you can really get a good idea of where or how the skin is going to react. However, if your client is somebody that you've known for years but you've just kind of done the basic facials over and over again, but you really want to prepare their skin for more advanced treatments, maybe you do the stage 1 treatment, no problems. So then you immediately bump them up to stage 2, and then maybe you keep them there for a couple of treatments before graduating them up to stage 3. So really, this is customizable for your clients to meet any of their needs. Now, if you notice down at the bottom in blue, it says home care is a must during the conditioning process. And I cannot emphasize this enough, because coming in every 2 or 3 weeks is great, but if they're not doing the appropriate skincare regimen at home, then every time they come back, you're going to be fighting, with the skin, moving backwards instead of forwards. So we always like to encourage our clients and tell them that the importance of home care is really about 80-20. So 20% of what we do as estheticians are going to make an impact on the skin, but the 80% is up to them to commit to good home care. Remember, going out there and purchasing the appropriate tool that they need. So in our analogy of the marathon race, getting a good pair of running sneakers, right? So getting a really good home care regimen that is customized for their skin at that time, and then going home and using that home care consistently and faithfully, right? And then coming back periodically to see you, the esthetician. All of this together will actually transform the skin. If you think about it, our skin is the largest organ in the body. It's a living, breathing organ, and anything that we do on the outside or in the inside does affect how our skin looks and responds. It's the same way if you like going to the gym. If you like going to the gym just to, have a healthy heart, or to tone and tighten your muscles and your overall body shape, maybe it's to lose weight, what have you, consistency is really the important process there. You can't go to the gym once a year and expect to, have a nice, firm, tight body, right? So skincare, working on our skin with good home care and professional treatments is what's going to make that change in the skin. So let's talk a little bit about home care and the reasons why these products are so important. Number one, customization. So again, depending on the season, depending on lifestyle changes, your client's skin might change, and you might have to change up the products that they're using at home. A good skincare regimen also provides consistency, right? So it means that they're doing their part at home, and then when they come to see us, they're going to have enhanced facial results. This all culminates to prevent future issues like a compromised barrier, and at the end, cost effective, because they're not coming in for all of the corrective treatments because they've done something egregious to their skin at home. So getting the professional treatments provided by you, the esthetician, and having your clients have a good home care regimen, right, is essential to the process and the progress of our conditioning program. Now, Here at Dermodality, we do have a home care regimen. Now, this is just sort of a suggested home care regimen. Of course, depending on your client's skincare needs and their skin type and their, lifestyle, what have you, you might want to adjust this so that it's personalized for them. But basically, we encourage you to recommend the Mandelic and Green Tea Cleanser. This is a universal cleanser that is great for everyone. Our vitamin C intense is packed full of stabilized forms of vitamin C and hydrators and other antioxidants to help protect the skin during the day. So, not only the skin, but the cells underneath. Then at night, you want to recommend our vitamin A intense. Now, this is a 0.8% retinol. And once when used at night, it really does help the repair process that our skin is naturally going through. So that retinol speaks very loudly to our body and our cells to encourage that repair and that healing. So you would want to use the vitamin C every day in the morning and then vitamin A at night. Next is a good anti-inflammatory moisturizer, which is our Moisture Soothe Plus. And then, of course, during the day, you always want to follow up with a sunscreen. So I'd like to turn it over now to Miss Victoria, who's going to take some time and talk to you about our conditioning treatments and your cost per treatment and what your return on investment could look like. All right, take it away.
Hello, everybody. Thank you guys all for being here. This is a good presentation, Lisa. Thank you so much. I have so much to say about skin conditioning and everything that we're doing. So I'm going to try to get it all out. But some of you may know we moved our corporate headquarters from California to Las Vegas, where we, do everything. We even just built a 900-hour advanced aesthetic school that we launched January of last year, and we've been running programs through, and it's all been going very good. In fact, one of our first students is on this call right now. And then right next door, we have our own wellness and med spa that was primarily built for our students post grad to help support them. So we are taking clients and we are experiencing all the things that you guys are also experiencing, which I think kind of makes us a little bit different in that respect, is we can see it from your point of view from the treatment room. All the protocols that we build, all and suggest, we utilize those. They're nothing that we just kind of throw out there. They're practiced and they work beautifully. So at our spa, we have a very specific program, if you will, and it starts from the very onset of the first client coming in. And it is a 60 to 90-minute consultation where we do a complimentary skin scan. We have a facial analyzer, which we will be offering for sale soon. So keep a lookout on that. We have our basic kind of treatment that we offer at a very low price. We get them in at this very low price. We'll do the skin can't scanner. Everything we do is safe and effective. Pretty much our stage one protocol Lisa just spoke about. And then we sit down on a couch and we have a conversation with our customer, with our patient, I guess, if you will. And we get to know them and what their goals are and what they'd like to see and all that. And so it's a very methodical process and it works so well every time. And what we're trying to do is multiple things, but we're really trying to sell a larger package because we know that one treatment isn't going to cut it, right? We need several, and it starts with skin conditioning, but then what's the ultimate goal? Soon in the presentation, you guys are going to see a couple of our clients that I personally worked on, and I'll explain what you guys are seeing when we get there. But they're both darker fits, and one had a lot of hyperpigmentation. So I knew my goal was going to be to get this client to TCAs and multiple layer TCA with our retinol power booster. And then she also saw signs of early aging, which I didn't see, but hey, that's what the client sees. That's what they want. We have to listen, right? So I also incorporated microneedling with dermastomes. And I knew I was going to alternate these treatments every 30 days, 3 TCAs and 3 microneedling treatments. So if my client's coming in every 30 days, that's about a 6-month process, right? But I can't do that unless I skin condition first. So what we do We have a certain price for that, and kind of what you're seeing here on the screen. One treatment would be $150, which one treatment typically is never going to cut it. You need three or possibly more, depending on your client's fits and skin condition. So a series of three, we'll say, is $375. My cost on that, you're going to see that over here to the left, is $2.50 to $4.50, and that includes your cleanser, prep pad, your base one or level one peel, possibly even a pumpkin peel, and your finishing serums. So you can see the return on investment is quite high on that. So what we'll most oftentimes do is sell this larger package for $2,000, $3,000, depending on the things that we're doing. And of course, we're in Vegas, so we have more flexibility with our advanced licensure. We can use lasers, RF microneedling, the TCAs. We have so many different options. So we have a little more flexibility, but even still, you guys can get creative in the states where you're at, and by strategically stacking protocols and all that. So our packages are normally $2,000 to $3,000. I know that skin conditioning is non-negotiable. I need that for the client outcome, for my skin insurance, for my peace of mind, knowing that this process is going to go smoothly. So typically we'll comp that. So they feel that they're getting a great value, and they are. They're coming in they're coming in every 2 to 4 weeks, as Lisa mentioned. So that's more opportunity for us to sell retail and just see the client's journey. And again, okay, I got $375. I'm saving $375. So they're more likely to commit to that larger package. And then we do payment plans, et cetera. Or sometimes they pay in full. So, and every time we're seeing great results because we're getting to that end goal, to those more aggressive treatments. And I hope that as of right now, through this PowerPoint, through this training, you guys are starting to see that skin conditioning it's a process. It's a clinical mindset that you have to adopt. And it's not, we have suggested protocols, but there's flexibility in that. And that's based off what you're seeing and what your client needs. But it's focusing on conditioning before correction. But through conditioning, we always achieve correction, a major correction. And again, you're going to see some of the photos here in a moment. So sometimes you guys won't even have to go to those deeper protocols or those more advanced protocols if you don't want, or if your client can't afford it. Simply through just skin conditioning protocols, you're going to see such phenomenal changes in the skin. So the cost, I mean, your ROI on this is could be huge. And what you guys will ultimately charge is going to be based on your demographics, your state, what you guys offer and all that. But there's still an opportunity to make a lot of money and mostly give your client that dream outcome, right? That they've always wanted in a safe and effective manner. I think we can go to the next slide, Lisa. So, as Lisa mentioned, we also we can condition the skin by using dermasomes or exosomes, which I don't know if you guys have been to a training or not, but we actually are about to launch a 13 episode go at your own pace style training. Each episode's about 10 to 18 minutes long. It's very thorough, very in depth. Talks about what are exosomes, different kinds that are out on the market, what to look for, red flags, how to build protocols, how to speak about them to your clients. It's going to be really great. Exosomes are next level. It's a premium protocol. And personally, we feel everybody can benefit from exosomes. There is no harm in them, are specific dermasomes, and you'll learn that there are some products out there that are claiming to be exosomes and they're not, or depending on the source, they can be damaging, but ours are phenomenal, best in class. And recently we've partnered, or we're offering a device called the Juvasonic, and we're happy to tell you all that we are actually selling that through Dermodality. And if you ever did want to purchase one, you do get a 20% discount on your Dermodality order. Also, we are having a mini training on the Juvasonic with incorporating Dermodality serums and exosomes this Thursday at 10 a.m. So we'll put up a registration link on our Instagram story, and also When we do a follow-up, we'll send you guys this recording and I'll include the registration link for that. But I don't want to go into a rabbit hole on what that is. But it is a very effective delivery tool for not only exosomes, but for a lot of our serums. So let's just talk about exosomes. So, and again, this is more of a premium service, so your cost per treatment is a little bit higher. And first, you need to determine what your cost of your vial is. We sell, if you bought a 3-pack from us, that means each vial is $200. You could realistically get 10 treatments out of each vial. That would be 1 billion exosomes per treatment. And it's very effective. We actually recently did a case study on this with one of our students at our school, and we have the before and afters to show you guys her journey. And it was only over the course of 4 weeks. It was 8 treatments. Phenomenal changes. So 1 billion exosomes absolutely works. And you'll understand once you see the exosome training, the value of a single exosome. But it's costly. So first you need to determine the vial, right? Your vial cost. If you're paying 200 and say you just want to double that to make, the vial 400, that would mean, and you want to make $200 on your vial, right? That means you have to charge at least $40 per 1 billion exosomes. And then if you're using a Juvasonic, the tip I think is $20. So that, let's say your cost is, well, your cost would be 60 on that. But you're charging at least $250 for that one treatment because it's a premium service. And at our spa, people are buying it left and right because we know how to add the value of an exosome. So it's just a temporary disruption of the stratum corneum. So this is perfect for somebody who has very sensitive skin who you might not want to start on even the mandelic peel right away. You could do a series of exosomes to help condition and strengthen the skin barrier, and then take them to the mandelic and pumpkin peel protocols that we've built. So there's so many ways to address a compromised barrier, just as dependent on what your client really needs and what you suggest to them. But no matter what way, whatever option you choose, it's going to be optimal for the client instead of choosing something that's too inflammatory too early on in their journey. That's where the estheticians are, even anybody in the industry, nurses and doctors even, who do something too excessive. It's too much inflammation, too excessive, too early on is where they see damage. And I think even Lisa included a photo of somebody who had a TCA done too early on and had third-degree burns. So I hope all that makes sense. We'll have more trainings on this. We're even going to launch another training soon on how to give an effective consultation utilizing the skin scanner and SKNditioning. So if you liked what I was talking about, we will have a training coming up really soon on that as well.
Thanks, Victoria. That was awesome. Awesome. And I haven't showed that picture just yet of the person you were just talking about. But one of the things that I kind of wanted to add in is I've been in the business, the aesthetic and beauty business for many years. And when I first got into it, facials were more just relaxing, right? A deep cleanse, you do extractions, you do a little bit of a mild exfoliation, give a great massage, right? And then your client is on their way. And you cross your fingers and hope that they reschedule with you. But today, what I've noticed is our business, our industry, the aesthetic business has changed completely. And it is more about these correction treatments. Clients nowadays, fluff is nice, massage is great, but they're really looking for transformative skincare. And so by creating this skin conditioning program that we have and teaching our partners how to gradually build our client's skin up to a stronger, healthier barrier by incorporating different devices like our Juvasonic and our premium dermasomes. What we've done is we've really elevated that correction treatment to a whole nother level. And so then our clients are seeing significant improvements in their skin faster. And so as we do our business as estheticians, what to kind of piggyback on what Victoria had mentioned about series, right? One facial is great, but you're going to see temporary, maybe for a week, good results. What we really want to do is put them on a series of treatments. 3 is really the minimum, but I would say 6, and how you price at minimum of 6, and how you price that. There are so many different ways that you can say, buy 5 and get the 6th treatment for free, or purchase 6 treatments and get your home care for free. Or, there are so many different ways that you can promote these series. But what this does, what having your clients commit to a series of treatments does for you is, one, it ensures that your books are always full. 2, it ensures that they're not going somewhere else for another esthetician because they spent that money with you, so they're going to continue on their investment. 3, you can then recommend home care products and be able to customize it over that treatment series time, right? Because again, things change, like our seasons, or somebody may or may not start medication, or they may have just a terrible stress event that happens in their lives, and that's going to affect their skin. Well, if they're coming back to see you time and time again, guess what? You're going to be able to pivot and focus on that at that particular time. If she's not coming back over and over and over again, then they may go somewhere else, or worse yet, they may not go anywhere at all, right? And so series is really the way to go, because this is what people want. They want to see that corrective skincare. They want their skin to glow, to hydrate, to be tighter, younger looking, etc. So with that, my next slide, I'm going to set this up just a little bit, but my next slide is the slide that Victoria was talking about. And this is a person, a gentleman that went in and had a treatment with an esthetician, and I can't say what they did, but I can only assume, again, based on my years of experience, that the esthetician didn't take the time to properly consult with them, do a skin analysis, and get to know them. Because the treatment that they decided to do, which wasn't part of any kind of skin conditioning program or prepping the skin, was a TCA. So here we go. Whoops. There you go. So this is a gentleman. This is someone who was all over the internet and social media because of his situation, right? He went into an esthetician, wanted to get a facial, and through the process, she did a TCA. Now, in dermodality, you can definitely do a TCA on higher fits, right? But the key there is to precondition, condition their skin so that we don't cause severe burns. So as you can see, what he looked like on the left before having the treatment, and then on the right, this is where he's in the hospital in a burn ward. You can see the devastation on his skin. And it's not just us as estheticians looking at this and saying, hey, this was really devastating, but it was also devastating because he eventually took her to court, sued for about 500,000, and the jury was so moved that they awarded him $1 million. And unfortunately, I don't know what his skin looks like today, but I can guarantee you that it probably doesn't look like on the left. So he's going to have some patchiness, some rougher areas of the skin. And this is just a really sad situation because the esthetician didn't take the time to properly get to know her client and properly condition his skin. Now, when we talk about proper skin conditioning, here's someone similar Fitzpatrick, right? And we can take you on the journey. So if we look at the picture on the left, this was the pre-picture, right? So kind of rough, uneven texture, hyperpigmentation, some blotchiness. And then the right is a more recent photo. And this is someone that does come into our spa. He comes into our school, he comes into our med spa, and has treatments on a regular basis. One of the most impressive things about this gentleman, and I just want to hold on, just get his notes here. One of the most impressive things about this gentleman is that, yes, he has had a series of skin conditioning treatments, but his treatments were done prior to us creating this this formal outline, this program. So I just want to kind of quickly tell you what his treatments in the skin conditioning process were like. So back in 2024, in late September, this gentleman came in for just a mandelic peel. We left it on for about 3 minutes, but he was really at a level 4 and warm, so we removed it early. Then we applied the gel mask and left that on for about 10 minutes, and then we finished with an application of our Hyaluronic Pro, Moisture Soothe Plus, and sunscreen. We also sent him home with good skincare. Why? Because he wasn't on a regular skincare routine. He was just doing whatever, probably was in the shower. So we recommended and gave him the Mandelic Cleanser, the Mandelic Toner, Vitamin C Intense, M Corrective, Moisture Soothe Plus, and sunscreen. So then, about 6 weeks later, around mid-November, he came back. This time, we put the Mandelic on and left it for about 5 minutes, and he had no sensitivity. And this is in due partly because of the home care that he was committing to. After that, we applied the pumpkin right on top of the Mandelic and left that on for 5 more minutes. We neutralized and removed all of that, and then we applied the gel mask again. This time we added in our anti-inflammatory concentrate booster to help calm the skin even more. And then we followed up with moisturizer and sunscreen. This time, though, we sent him home with additional products. We sent him home with our HQ Lightening Gel and our Peptide Plus Moisturizer. The third treatment happened about 6 weeks later, again in late December, and this time we bumped him up from the Mandelic peel to the intensive brightening peel, layered that with the pumpkin, and we left it on for the total protocol time, which is about 14 minutes. After which we removed the 2 layers, and then we applied the gel mask with Ignite and Calm. That's our anti-inflammatory booster. And then finished with the Intense Cascade 2020. So after that, we didn't put any other serums on the skin. We didn't put a moisturizer or any sunscreen. We just put that Intense Cascade, which is that 8% retinol, and we sent him home. So after that, we have just then continued to do a series of treatments. So he's had nano infusion, microneedling, several different chemical peels. But most recently, and I think this was last October, we actually took him to the very next level, which was a 3-layer or 3-pass TCA peel. Yes, you heard it right. 3-layer or pass TCA peel. We used our TCA 15 and we finished it with our Intense Cascade, that 8% retinol. And so let me take you on his journey. So if you look at his first picture on the upper left, you can see this is what his skin looked the day after the peel. So we did the peel and this was right after he took a picture. And then as we move down the line, you can see over the days, next few days, his skin does get a little darker, meaning that it brings up that pigmentation, right? So it's pulling any underlying hyperpigmentation that's kind of lying dormant under the skin and pulls it to the surface. In the third picture, you can now see kind of around his mouth area, which is typical. You can start to see he's starting to flake. By the time you get to the fourth picture, all the way on the top right, you can see that his whole upper lip has been exfoliated, and now that exfoliation is moving outwards to his cheek. If you go right below that, he's wearing a baseball cap in this picture, but again, you can see how the exfoliation or the shedding of his dead skin cells keeps moving out and out and out. And then finally, the one just to the left of it is when he's in his the finishing stages of going through all of this. The next two on the left are his after pictures. And so I just want to kind of show you a real before and after. So the picture on the left is before we started the TCA, and the after is what his skin looked like after he had gone through the whole shedding process. So Remember, he's a fit six, a guy who probably didn't use good skincare, home care regimen, but was committed to improving the look and the texture of his skin. And oh my gosh, we did basically the same thing that we did to the first gentleman that wasn't preconditioned. And we conditioned Jerry's skin. And this is our result after the TCA 15 with the retinol booster. So again, this is definitely an indication or positive proof of how proper skin conditioning, gradually working your client's skin up to more advanced treatments, can definitely make a difference in their skin. All right, so this next one is a client that Miss Victoria has been working on, and her name is Laura. And I'm going to let Victoria take over on this one because she has been working with this client, and I have some other before and afters of her as well. Take it away, Victoria.
Thank you, Lisa. I think move the slide over one, unless my computer is frozen. We're still on Jerry. There we go. Okay, so and I just want to point out too that this is so important because so many industry professionals are fearful of peeling darker skin types, and so they won't, and they miss out on revenue. And it can be done. We do it all the time. We see such great success with Jerry, and I mean, he was like the perfect case study because, as Lisa mentioned, we did that Mandelic peel on him and he felt it, which is, if you guys have used the Mandelic peel, you'll know it's so gentle. So it just tells you so much. And it was perfect case study. He loves his results. And had we been charging him appropriately, we would have made a lot of money. But he was a case study and a friend. So this is Laura. She came into our wellness and med spa with obvious, hyperpigmentation issues. This was the lady I was speaking about earlier who said that she saw signs of aging. So she also wanted more collagen elastin. So we threw in the microneedling there. This was her very first photo at the end of September last year. And okay, you can go over, Lisa, if you don't mind. This was at the top left there, the first two photos you see. This is after her skin conditioning series. We did 4 treatments in office, so spaced out every 2 weeks, kind of the same progression as Jerry. Mandelic first time, gel mask, LED, came back again, Mandelic again with the pumpkin, so on and so forth. And she committed to home care. So she's using vitamin C intense of Dermadalities, vitamin C intense, vitamin A intense, and a few other products that we had recommended. And the top left was after the 4 skin conditioning treatments. So this is what I mean when we say conditioning before correction, but through conditioning, we achieve correction. She was so thrilled with these results. And then the redness there that was after her first TCA, she'd never had any in-office treatments. And so she didn't know what to expect. And she was texting me every day, asking me if this normal, if my skin feels sunburnt, it was swollen. And I was calm and cool and professional the whole time because I've seen this before, and I have so much faith in our skin conditioning method that I knew she was going to be just fine. So I reassured her every day, gave her, apply Hyaluronic Pro and Moisture Soothe Plus, don't go in the sun, yada yada yada. And then the results on the bottom right are after that first TCA. So, Miss Lisa, can you swipe back really quick again just to see the before? So from here in September, now go again to the right. This was just a couple months difference. Huge changes. She was so happy. We were all happy. And this is available through you guys, for you guys, through skin conditioning.
That's so amazing. And so, what we're doing, I mean, look at this journey. I mean, eh, gosh, I mean, like you said, many estheticians are very um, cautious and even afraid to work on darker Fitzpatrick's. But the whole process of what Tony has been talking about for years, and we just recently just put it down on paper, is how to properly and how important it is to condition anyone's skin. And so what we've learned, because Tony has always talked about, oh, our level two peels, which are Jesner and TCA, can absolutely be used on higher Fitzpatrick's. But does that mean that our formula is different from anyone else's? Could be, but more importantly, it's because we take the time to educate our partners on the importance of preconditioning their skin so that we're not taking that first gentleman that saw that esthetician, we're not taking him and throwing a strong acid on the skin and hoping that everything works out. No, we through skin conditioning, we are creating predictable results for our clients. And again, home care is a big part of that. But during this process, again, we can customize that home care. So we can titrate up on something a little stronger, or we can remove something and slowly gradually introduce that product in again. So yeah, so this has been absolutely phenomenal. Tony, I wanted to ask you, do you have any thing that you want to add on this? And then afterwards, guys, I have a couple of fun things I'm going to share with you.
Yeah, I do. And I really just want to talk about, when I see a lot of people have answered with retinol, and it is an incredibly important ingredient from an anti-aging level, but it's just not any retinol. The concentration, and that's always been really the key feature in what we have, can be as much as 9 to 10 times stronger with ours. And when you think about the strength, you first think, oh, wow, that's going to be too much for some people. And it may be. And the difference between Dermodality and I think any other group of products is that we created the ability to have the interaction with other products that were designed to work with it, the symbiosis, we say. So if someone were to be sensitive, I can always use our Mandelic or M corrective underneath and then layer the vitamin A over the top or mix the two together. So everything has the ability to adjust. So we always speak to, and I think you guys know this, and we've said it before, but those of you that have not worked with us, what's so amazing is that you can work with any skin type. You're not limited. It's basically you have the ability to do everything and anything to achieve that final goal. It's not that difficult. It's pretty basic. It's a lot of common sense, and then just adding you talk about the high performing ingredients. There's a high concentration. It costs quite a bit more. If it's okay, I can share a little bit with you. There's an ingredient that we use, and it's called Restore Skin. It's plankton, lecithin, kelp, seaweed, and algae, I believe, all those ingredients in one that makes it active. And when we're developing the line, one of the things we wanted to achieve, especially with moisture, is to seal the transepidermal water in with the product. So the clinicals were used at 0.5% that it showed great ability to do this, but it really didn't give us everything we wanted. Once we brought it up to 2 or almost 2, we were able to get the sealing of moisture in at a level that I don't think has ever been seen. That cost us about $2.26 more for that ingredient that we're putting in the product. So I'm giving you a little, insight to the cost, but we've not just done that with that product. We've done it with most of our products. So it's a high premium, product, and I'll let you finish on that, but I just wanted to share that.
Thank you, Tony. That is awesome. Um, let me see here. All right. Okay. So I'm going to continue on because, like I said, I have a couple of little things that I want to share with you. And so I wanted to, though, ask you one more question. Okay, one more question. And thank you for your responses about the number one anti-aging product. I will reveal the answer here shortly. But the next question that I wanted to ask you is, in this conditioning program that we talk about, we include or we incorporate something that we recommend to our clients. Now, I mentioned it several times, and I just wanted to see if anyone can remember what our clients need to do in conjunction to coming in to see us for those professional treatments. All right. Well, while you guys are answering that, so again, I'll say it again, we recommend something to our clients that needs to go in hand with coming in to see us for those professional skin conditioning treatments. And what is that they have to do? So with that said, I'm going to go ahead and go to the next slide here. Oops. Okay. Here we go. Good. All right. So it wouldn't be a presentation without introducing a way that you can utilize these level or these 3 stages of conditioning protocols easily. And so what we have created is our essential conditioning pro kit. Now this is an all-inclusive kit that contains everything that you would need to have in order to perform those 3 different stages of facials. And so we incorporate all of our the appropriate cleanser, the back bar products, including the masks. We do the moisturizers, sunscreen, and eye cream. But wait, there's more. We also include several essential conditioning pro kit extras. Things like our Hyaluronic Pro, facial massage cream. We include a fan brush, retail brochures, notepads, home care guide, and retail bags. And then also included in this is, I had mentioned this earlier, the importance of talking about home care, right? So in this, we've included 3 mini kits. Each kit contains 5 mini products. And this is something that you can mix and match and then give to your clients at the end of your first treatment or as part of the series. If they purchase a series, this one of these kits can be included, or you can just sell them on their own. This starts the process or starts the conversation of the importance of that home care. Now, here's the next big kicker. So if you were to purchase these at your cost, the initial investment would be $550. The extras would be approximately $253 with the total value of $803. So last year, we actually offered this special for $499, and this gives you approximately 30 treatments. And where that 30 treatments comes into play is on the Mandelic solution, the acid peel, because you can only get about 30 applications with that, but many of your other products will last much longer. So, but because we love our estheticians and our partners, and we really want to set you off on a good path for conditioning your client's skin, today we're not going to offer that package for $499, but for $450. And this promotion only lasts through the day. So you have to get your order in before the end of the day. And that's, I don't know, Victoria, I'm going to say like not necessarily our end of the day, which is about 5 o'clock, but I'm going to say something like maybe, closer to midnight. And so this is an absolutely phenomenal opportunity to stock up all of your essentials and start beginning your conditioning programs and scheduling those series of facial treatments. All right. So skin insurance, what it means for you and your clients. Well, fewer risks, better results, more confidence, trust, and loyalty, right? So it builds that relationship for your clients and with your clients. And especially by having them book those series, you've got clients that are going to come back time and time again. And then I do have one last sort of before and after. This is of Miss Victoria. And this was taken in August. The first picture on the left was taken in August in 2024. And then again in January of 2025. Now, Victoria's been with Dermodality for a long time and has been using the home care products forever. But rarely did she do anything more than a base one peel or level one peel with a pumpkin on top of that. And that was just because of her busy schedule. In August, she began a series of advanced treatments, including level one layered peels, or number one, sorry, let me go back. Level one peels layered with pumpkin, and then finishing with our dermasomes. She also included fractional radio frequency. She did that a couple of times, spaced out about 6 weeks apart. She also did microneedling, followed by our dermasomes. And then she did the process, and this was all done in one day, all done in one day. Microdermabrasion, IPL, microneedling, and then applied dermasomes on top of that. So how could someone do all of these advanced treatments like the microdermabrasion, IPL, and microneedling in one sitting? Because Victoria's skin was properly conditioned, because she's been using the home care and getting these treatments for years, that her skin was actually ready to go the distance on a more advanced treatment. So this is, again, it's not just about elevating your clients from a level one peel to a level two peel, right? It's about combining these more advanced modalities on top of each other to achieve amazing results. There we go. My computer's not moving forward. There we go. So our goal here at Dermodality is for all of our partners to become skintelligent about the importance of skinditioning. And we're going to do that through a in-depth consultation, skin analysis, setting up realistic expectations, remembering and educating our clients on the 80-20 rule, home care, and most of all, commitment. So that ends our presentation for today. Please remember to follow us on Facebook, like us, and become partners with us on Instagram. If you are not already registered for a pro account, please go to our website and do that. All you need to do is upload your current unexpired license. And if you're a student, just proof of your time at school. And then if you need to get a hold of us, you can always reach us at the phone number. Or if you have any questions about any of our products, any of our ingredients, and how to use them and all of that kind of good stuff, you can always email us at education@dermodality.com. All right, so I'm going to switch back over. I'm going to stop sharing.
Actually, Lisa, oh, I was going to say there was somebody who wanted to take a picture of the kit.
Oh, okay, hold on.
Content.
That's easily done. All right, hold on.
Thank you
Okay.
guys all for being here. As Lisa's getting that done, we'll send a follow-up email, as I mentioned, with the recording to this presentation so you can watch it again. And then the link to register for our next free training, which is this Thursday, and it is going to be covering the Juvasonic device and what that is. And it is a class 1 device, just so everyone here in California, everyone on this call from California knows it is class 1 device, so you can use it in California, and how to incorporate it with our dermasomes and dermodality serums. So that's on Thursday at 10 a.m. and we'll send that registration link.
All right. So I'm just taking a moment to go back to our kit. So so this is the one with the extras, and then I will also show you the final on that pricing. Okay. So I bet everybody wants to know the answer to the question. And so let me just go back on here. So it kind of was a trick question, and I'm sorry that I did that. But the question was, what is the number one anti-aging product on the market? So product was the key word, right? So a lot of you mentioned retinol, and actually, retinol is a really powerful um, uh, anti-aging product, but ingredient, I should say, but retinol is an ingredient. It's not a full product. So the number one anti-aging product is sunscreen. So we do have a winner for that. And just to kind of let you know a little bit about retinol, yes, retinol has been proven time and time again to help with the aging process. But did you guys know that actually retinol, or more specifically retinoic acid, didn't start off as an anti-aging ingredient? It actually started as an acne treatment. And later, as women's skin started to become more refined and their fine lines and wrinkles started to soften, it then transferred over to a very powerful anti-aging ingredient. So does anyone, I'm going to see if I can, I'm going to see if I can open up everybody's mics, or you can just open them up yourselves. But does anybody have any questions about the presentation, about products, about ingredients?
I will say one thing. This is Victoria again. The answer to the second question, I don't know if you mentioned that, was home care. So everybody got that right. So what we'll do is I took screenshots of everybody who participated, and we'll go look at your email through registration, and whoever won, I'll request your address if we don't have it via email. But good job.
Yeah, good job, you guys. I'm looking at all these answers, and I'm so sorry that so many of you answered retinol, but it is the number one anti-aging product, which is sunscreen. And, getting sunscreen on individuals at an early age, right? Because the earlier you can get them, I wish I had been more uh, in tune or in the knowledge or in the know with using sunscreen when I was in high school and college years. I probably would have better skin than I do, but that's okay because I'm working hard on it now with my dermodality skincare products and treatments. All right. Anybody have any other questions? If you want to open up your mics, you can. Um, Thank you very much for all of your comments and your positive feedback. I'm so happy that you all learned so much from this. And hopefully you will continue to follow us and come to our classes too. We do offer Dermodality Skin Solutions classes, and both in Las Vegas and in Southern California. And along with that, we will be doing this year, creating more classes, different classes. They'll all be at an advanced postgraduate level. And we'll also be offering them on our website and and recordings, including our 13 episode series on exosomes. This is a phenomenal presentation or series that's just going to kind of go through everything you ever needed to know but didn't know you needed to know about exosomes. And we're going to talk about the truth, facts versus myths, where they come from, where our exosomes come from, and why we're so committed to incorporating our dermosomes into our treatment with our clients. All right. Anybody else got any questions? All right, Tony, Miss Victoria, any final words?
I just want to say thank you for everybody that participated. I noticed that virtually everybody stayed on the whole presentation. That attributes to yourself, and I want to thank you personally. You did an amazing job.
Thank you. Well, I had great information, a great information source to pick from. So thank you, Tony, for developing this fantastic line and for really acknowledging the importance for all of us estheticians about that, and also to Victoria for, helping to write this presentation and really do the case studies that just prove our point that when the skin is properly conditioned, right, that we can do pretty much anything on any skin type and any fit spectrum.
Yep. Thank you, Lisa, and thank you everyone for being here. And I guess just as we wrap it up, I'm reading the comments and loving all the positive feedback that really means so much to us because we do spend so much time talking about how can we help elevate this industry. There's so many ways and so many things that we can do to help change our mindset from what we thought once was into versus what actually is true and how things really work. And early on, we asked everybody what they thought skin conditioning was. And because we know it's kind of understood in the industry that it's maybe one product, maybe a retinol product that a doctor or a nurse or an esthetician sends a client home before they start their journey, or just one hydration facial. And that's just not the answer. And that is why we see so much damage still in this industry. And so by understanding this process and understanding that it is a process, and it's not just 3 protocols or 6, it could be more. And it could be different home care. And this is why you got to keep learning ingredients and understanding the function of the skin and always staying abreast to what's new. But knowing that it's a process and adopting this process and implementing into your treatment room is going to just expand your revenue, your client outcomes, and overall, it's just such an amazing thing. So I'm just so happy that everybody learned so much. And thank you, Lisa. Thank you, Tony. I hope everybody has a wonderful day, and I hope we see you guys all on Thursday.
All right.
Again,
Take care, everyone. Thank you for
take care.
joining. Bye bye.
Bye-bye.